Good evening, everyone, and a very warm welcome to all of you joining us today for this important and enlightening webinar, Understanding Brain Tumors in Older Adults, Myths, Facts, and Hope. This session is being brought to you by Vayah Vikas in collaboration with Kauvery Hospital, and we are delighted to have your presence here this evening. At Vayah Vikas, our mission is to empower senior citizens to lead fuller, healthier, and more informed lives. As we know, neurological conditions, especially brain tumors, can often be misunderstood or misdiagnosed in older adults due to overlapping symptoms with age-related changes. That's why today's topic is especially important. This session is aimed at busting common myths around brain tumors, helping you recognize early warning signs, highlighting the latest diagnostic tools and treatment options, and most importantly, showing that there is always hope with timely intervention, expert care, and the right support. We are honored to have with us leading expert in the field, Dr. Vinayaka M, consultant neurosurgeon at Kauvery Hospital, Marathalli, Bangalore. Dr. Vinayaka brings with him over 16 years of experience in neurosurgery. He completed his DNB neurosurgery from St. John's Hospital, Bangalore, and went to pursue a prestigious fellowship in cerebrovascular and endovascular neurosurgery, spine surgery, minimally invasive neurosurgery, and skull-based neurosurgery in Japan. His advanced skills in complex neurointerventions have helped many patients access cutting-edge treatments, often through minimally invasive procedures. We are grateful to have him here to guide us through this complex and crucial topic and offer clarity, compassion, and science-based insights. Without further ado, please join me in welcoming Dr. Vinayaka M. Over to you, Doctor.
Yeah, thank you for the kind introduction. So now, because the World Brain Tumor Day is coming up on June 8th, so I took this opportunity to spread awareness regarding this complex topic. So I'll be sharing a presentation. So mainly the theme for this World Brain Tumor Day for 2025 is increasing awareness for a healthier tomorrow. So World Brain Tumor Day is observed 8th June of every year, was established to draw attention to brain tumors and emphasize the need for increased awareness about them. The day encourages communities to learn more about the condition, recognize the possible symptoms so that they can support the early diagnosis. Awareness helps to improve the outcome by making people more alert to early stage brain tumor symptoms that may otherwise go unnoticed. So coming to the introduction, like I'll be going through the introduction, then how we diagnose it, what are the imaging techniques we have, and what are the recent management techniques we have for the brain tumor patients. So what is brain tumor? So as you know, brain tumor is an abnormal growth of cells within the brain or a spinal cord. And in brain tumors, they have two things, that is benign or malignant. So benign is non-cancerous and malignant is cancers in a common terms. And there are two types. They can arise from the brain tissue. We call it as a primary brain tumors. And they can arise from the other tissue spread to the brain. We call it as a secondary brain tumors, which metastasize from the other organs. So primarily it falls in two groups, primary brain tumors and secondary brain tumors. In a primary brain tumors, most common thing is gliomas. We call it as a glioma, which arises from the supportive cells of the brain when they undergo abnormal growth. So there can be two types in that. They can be benign also, they can be malignant also, depending on the stage of tumors. And if it arises from the covering of the brain, we call it as a meningiomas. These are two common types of the primary brain tumors. And sometimes there is one more gland, we call it as pituitary gland, which is in the center of the brain, which secretes some major hormones, which controls other endocrine glands in our body. If the tumor arises from that, we call it as pituitary adenomas. And other type of tumor, which is less common, is the tumor arising from the covering or the nerves, which are responsible for hearing and balance. We call it as schwannomas. And tumor arising from the cerebellum, that's the posterior part of the brain, which controls our movement, coordination, and balance. They are commonly called medulloblastomas. And the tumors arising somewhere else in the body, commonly breast, lung, or prostate, and spreading to the brain, we call it as secondary brain tumors. So most often I get this question like what causes brain tumor? So most cases, the precise trigger for brain tumor remains unclear. The changes happens in the cellular DNA, which leads to uncontrolled growth. But these alterations often occur by chance rather than from a single identifiable source. So we call it usually a multifactorial. And ongoing research is seeking towards uncover the biological process that set this growth in motion. Some factors may increase the chances of brain tumor, although having one or more of these factors doesn't mean that tumor will be definitely develop. This could include some genetic syndromes like neurofibromatosis, Leigh-Maloney syndrome, von Hippel-Lindau disease. They carry mutations that affect the cell growth and repair. Family history of brain tumors also puts at a higher risk of developing brain tumors, and age also plays a part. Like medulloblastomas are more common in children, glioblastomas are more common in the older adults. Exposure to ionistic radiation, for instance, like therapeutic, means treatment radiotherapy taken for earlier cancer treatment, has been linked to the later development of brain tumors. Occupational or environmental agents, including long-term contact with some industrial chemicals or high-level air pollutants, are under study for this possible role. So now coming through, what are the common symptoms? So common symptoms of brain tumors, it coincides with other brain pathologies as well. That's why it often goes missed. So we wanted to stress upon this. The symptoms of brain tumor depends on the tumor location in the brain, what is the size of the tumor, and what is the growth rate. If the brain tumor is growing faster, the symptoms progresses faster. If they grow slower, the symptoms also progresses slowly. So it is important to keep in mind that these symptoms may be linked to other common health issues. So having one or more of them doesn't necessarily mean that you have brain tumor, but these are the common symptoms which points towards a brain tumor. So seek for the medical attention as early as possible. Headache, and headache, as you all know, is a very common symptom. But this headache is a one which is persistent and which worsens over time, and is also a different from a typical headache. Second symptom is a seizure or a convulsion. So any seizure happening in an adult above 18 years of age points towards a like further detailed imaging of a brain to find out a cause. Changes in a vision. This all happening in older adults. When these symptoms appear suddenly and they start progressing, then it points towards a possible brain tumor. Changes in the speech, changes in memory, changes in cognitive function, such as difficulty in thinking clearly, recalling information, unable to speak or able to speak clearly, slurring of speech. All these are also seen in stroke, but there it is sudden onset and severe at the onset itself. But in brain tumors also can mimic stroke. So related to that, there may be weakness or numbness in certain parts of the body, mainly on one side of the body, involving the face or the hand or legs or all together on one side. Personality changes, mood swings that they seem to be out of character for a person. If these symptoms are noticed, it's important to seek a medical advice for a proper diagnosis and care, and as early as possible. While these brain tumors are relatively rare, recognizes these symptoms helps you to ensure prompt treatment and best possible outcomes if it is diagnosed early. If it is not diagnosed early, if it is being left untreated, or what happens? Because these brain tumors, they occupy space inside the skull. So this causes to increase the pressure inside the skull that we call it as raised intracranial pressure, which leads to the paralysis on one side of the body if one hemisphere of the brain is affected. Later, if it progresses, if the pressure increases so much that it leads to the complete dysfunction of the brain, leading to loss of consciousness, seizures which are uncontrolled, continuous, without any recovery in between. We call it a status epilepticus. And then if the loss of consciousness patient doesn't regain consciousness back, he might slide into coma and deepening stages of coma, ultimately leading to death. So how we diagnose a brain tumor, it depends on the symptoms, how it started, how it progressed, then what is the previous history, and then we perform a certain physical examination to find out what all deficits you have, like is there any problem with the power, is there any problem with the sensory sensations, problem with the speech, problem with walking, balance, coordination. And then we take a support of a imaging to support the diagnosis of clinical, whatever the clinical impression we have. So initial neuroimaging, what we advise is a CT brain, is a CT scan of the brain, then followed by MRI scan, which is having a plane, and also inject a contrast or a dye by IV route, intravenous route. So we call it as MRI with contrast. Then to image a brain, blood vessels of the brain, we call it as MR angiography. And there is a special MR imaging of the white matter tract. There is a connections in the brain. That's what called as white matter tracts. To see that, we have a MR tractography. These are the advanced imaging, which is decided on a patient-to-patient basis based on the type of tumor and the location of tumor to further plan the precise treatment. Then what we call as a functional MRI. This is for delineating the eloquent areas, means the most important areas of the brain which are dealing with the important functions, like which controls a motor function or a power of one side of the body. And importantly, it's used to specify the area of speech. Though we have anatomical locations of these areas in the brain, but each patient is different, each brain is different, and location of these areas in the brain which control specific function varies from patient to patient. Then other investigation, what we see is a PET-CT, we usually advise for the body, whole body, to look for if we are suspecting a metastatic brain tumor or a secondary brain tumor, means a brain tumor which has spread from other parts of the body, to find out a primary or the origin. We usually advise for a PET-CT scan. Coming to the histopathology, once brain tumor is diagnosed, if it's able to resect, we can take it a small piece of brain tumor and send it, or a whole part of the surgical specimen. We'll send it for the microscopic examination and detailed examination under microscope after using multiple dyes and preparation, because it's histopathology. And we also to go for the genetic markers, molecular markers, so that we can plan for the appropriate treatment further. The most important thing is early diagnosis is a key in planning the most appropriate treatment. So coming to what are the treatment options available? There are multiple treatment options available nowadays, multiple advanced treatment options. So it all depends on the several factors, like what is the type of brain tumor, what is the size, location, which we'll come to know with the imaging, which I had already discussed, and how much it has spread to other parts of the body or in the brain itself. We also take into account the patient's general health and the personal preferences in planning a comprehensive treatment for a brain tumor patient. In many cases, a combination of treatment is recommended to provide a better chance of success. Surgery is often a first option, especially if the tumor is accessible and can be safely removed. The goal for a treatment here is to remove as much as possible without damaging the vital brain tissue. In some cases, complete removal may not be possible, but surgery can still help reduce the tumor size and ease the symptoms or help in recovery of the neurological symptoms. So nowadays, the brain tumor surgeries are much safer and more advanced with the use of surgical microscopes, more good resolution, and also the newer technologies we have, like intraoperative navigation. Navigation, as you commonly know, like when you want to reach a place, you use your navigation or a Google Maps in a common life, like that. So we know the which path to take, how to go about it, so that we can precisely reach the brain tumor with the minimal injury to the normal brain tissue and remove it. We have one more known as intraoperative MRI. This is MRI scan done during the surgery. Means once we go and excise the tumor, then we check for the residual tumor. It's especially useful when there is a tumor which has irregular margins. So we check for any residual tumors so that we can safely remove without causing much damage to the normal brain tissue. So aim of the surgery is not only to improve the neurological deficit caused by the brain tumor, but also to enhance the patient's overall quality of life without causing any new neurological deficits. As a result, Most brain tumors today is very safe with minimal or new neurological deficits following the procedure. Moreover, there is high chance of neurological recovery, especially when the brain tumors are excised early, that is when they are small, not in a complicated locations, and are not spread extensively. There's other technique which we use it called as awake craniotomy. You must have heard about this. This is a newer brain tumor surgery technique. Here, the brain tumor surgery is performed while the patient is awake. Although the patient is fully awake, during the procedure, medications are given to ensure that they do not experience any pain or discomfort. Awake craniotomy is especially useful for tumors involving the speech area. The reason is that speech area of the brain is the one which varies very often in its location and very commonly from person to person, and it cannot be precisely mapped in advance using advanced imaging techniques. In that case, during awake craniotomy, what we do is that patient's speech function is in real time is tested as we remove the tumor so that it will allow us to tailor the extent of tumor resection to avoid speech deficit. In most cases, here, when the tumor is involved in the speech area of the brain, is to achieve maximum safe tumor removal, thereby prolonging the life expectancy of a patient. And in case we are left with an option where we need to leave behind a small portion of tumor to protect the important function of brain, which can be treated later with a radiotherapy or a chemotherapy or both, depending on how these tumors are sensitive to these treatments. Ultimately, our goal is to not to produce any fresh, debilitating new neurological symptoms and improve the quality of life post-surgery for these brain tumor patients. Other form of therapy is radiotherapy, which uses high energy beams such as X-rays to target and destroy the tumor cells. It is commonly used after surgery to kill any remaining tumor cells or residual tumor, or it can be used prior to the surgery if tumor is not possible, or to reduce the size of tumor so that with the surgery we'll be able to achieve complete removal or a maximal removal. Radiotherapy, we have a gamma knife, cyber knife, stereotactic radiosurgery, stereotactic radiotherapy, which are more precise form of delivering the radiotherapy to the tumor tissue, avoiding damage to the normal tissue. Then we have a chemotherapy. These are chemotherapies are medicines which are designed to kill the cancer cells or to stop the cancer growth. They may be used in conjunction with surgery or along with radiotherapy, especially if the tumor is malignant. And chemotherapy are often given in cycle with rest periods in between, like 5 days in a week with 2 days rest in between. So the body is allowed to recover. The other newer forms of therapy is targeted therapy, where the specific drugs are used, which target specific molecules involved in the growth and spread of cancer cells, which are expressed by the cancer cells or tumor cells only, and they are targeted to the specific changes in tumor cells, hence minimizing damage to the normal healthy brain tissue. The other form of therapy, what we have, other than chemotherapy, radiotherapy, targeted therapy, and surgery, is immunotherapy. Here, these are the newer kinds of, which is in under trial and improvement. It works by boosting the body's immune system to fight off the tumor cells. It is still being researched, but it's been showing some promise in some types of brain tumors, particularly glioblastoma multiforme, the aggressive form of glioma, one of the common brain tumor. Along with this, they require a supportive care, which is essential to manage the symptoms, improve the quality of life. So we use medications to control pain, nausea, vomiting, and seizures with anti-epileptics, brain swelling because of the tumor with steroids. Then if there is any deficits, so for improve that, we use physiotherapy, neurorehabilitation therapy, comprehensive neurorehabilitation therapy to help in speech, mobility, cognitive function after the maintenance. So everything is aimed at improving the quality of life so that the patient lives a dignified life. So other thing is, what is the prognosis? It's not that all brain tumors have a bad prognosis. It depends on the what is the type of tumor, whether it's benign or malignant, what is the location of tumor, and what is the neurological status of the tumor patient at the time of presentation. Like example, when is it diagnosed? Is it diagnosed at the earlier stage or in a later stage? So that's why we are stressing on this. Awareness is very important so that these brain tumors can be detected early, treated early for a better prognosis. Coming to what are the recent advances which is under trial, which will be coming up in future, which has shown some promise in treating the brain tumor. So these are proton therapy. It's a type of radiotherapy where proton beams are used instead of X-rays. Targeted drug therapy, which I already discussed. Then we have a tumor treating field where we use low intensity electric field delivered to a wearable device, which interferes with the cancer cell division, slows down the tumor growth. It has been tried along with chemotherapy for some of the aggressive brain tumors with glioblastoma multiforme with a promising results. Other one is a liquid biopsy where we detect the tumor DNA in the blood or a spinal fluid, which will help us in diagnosis and which can be used as a screening also in future if it proves to be helpful. And these developments offer hope for more effective and less harmful treatment options in future. Other common question what I usually hear from many of patients is that, or that patient relatives especially, can the brain tumors be prevented? Currently, there is no known way to completely prevent the brain tumors. However, there are some steps which may be followed by everybody so that we can reduce our risk of developing brain tumors. Mainly, avoiding exposure to the harmful chemicals like toxic substances, pesticides, or industrial chemicals have been linked to increased risk of developing some cancers, including brain tumors. Using protective gear in a work environment and avoiding unnecessary chemical exposure is advised. Limit the radiation exposure. High dose of radiation, especially to the head, have been associated with increased risk of brain tumors. This can occur from past cancer treatment or from very frequent exposure to sources like X-rays or CT scans. Then is healthy lifestyle. A direct link between healthy lifestyle and the brain tumor prevention is still under study. But generally, what we say is maintaining a general good health reduces the risk of developing certain cancers, like eating balanced diet, staying physically active, and avoiding smoking, are all beneficial to overall health and also helpful in preventing brain tumors. Genetic testing, this is especially useful in patients who have a family history of brain tumors or in certain genetic syndromes, which I already mentioned. With this genetic testing, we can identify a risk group and then monitor them closely, and then so that we can diagnose the brain tumor if at all it occurs at a very early stage, so thereby giving a very better prognosis. Although there is no guaranteed way to prevent a brain tumor, leading a healthy lifestyle, minimizing harmful ray exposure can potentially help lower the risk, and also having a better awareness about the brain tumors also helps in better diagnosis, better and early diagnosis, leading to better prognosis. So summary, brain tumors are widely in type, vary in type and behavior. Early diagnosis and multimodal treatment are key. Research continues to improve the outcome and quality of life. So, World Brain Tumor Day is an opportunity not only to learn more about them, but also to take a meaningful action. So, coming to the myths and facts. So, some of the common myths I've taken up here to discuss. The brain tumors, they have a common myth that brain tumors affect only the younger people. It is not like that. Seniors can also develop a brain tumors. It can also be seen in children. So there are different types of brain tumors in different age groups. Second common myth is that For the seniors, there are no treatment options. There are many treatment options available nowadays, as I discussed, tailored for older adults based on the patient's condition at the time of diagnosis of brain tumor. We can tailor-made customize the treatment plans so that patient gets a maximum benefit. Previously and even today, one of the common myths is that many people still believe if we advise a surgery for a brain tumor patient, it means that patient will be either permanently disabled or will not survive. This is not so with the recent technologies, recent treatment options which we have, and advanced surgeries with all the technologies which we use. In most of the cases, we are able to relieve the brain tumor, patients of brain tumor with minimal or no deficits post surgery, and improve the quality of life. So, what are the hopes we have for the future? There have been many advances in the treatment and care. Better outcomes are always there with early detection, and which requires support from the healthcare teams and families. This should be a holistic approach, and many researchers have been still going on in that thing, so that many new treatments will come up in future to help the patients with brain tumor. So key takeaways here is brain tumors can affect seniors too. Early warning signs is a matter. Treatment and care can improve the quality of life. There's proper treatment and comprehensive care. And stay informed and proactive. Thank you.
Thank you, Dr. Vinayaka, for your valuable insights and for breaking down such a complex topic with clarity and compassion. And a big thanks to all of you who joined us this evening.